Parentheses have a place, but not on your face. Lose those lines with Juvederm. Juvederm is an injectable gel your doctor uses to smooth out wrinkles. Like those lines on the sides of your nose and mouth? Instantly. Side effects, usually mild to moderate, included temporary injection site reactions like redness, pain, firmness, swelling, or bumps. Smooth, natural. Everyone will notice, but no one will know. Ask your doctor about Juvederm.
When I'd smile, they weren't as noticeable. But when I wasn't smiling, there they were, right smack in the middle of my face.
I'd catch a glimpse of myself and would think, who is that and where do those lines come from?
So I went to my doctor and I told him what bothered me about my face and I said, these.
I hate those parentheses lines. Is it okay to say hate?
I wanted them gone. The sooner the better.
I didn't want to look done. I just want to look like me.
Those parentheses lines, I used to have them too. That was before I discovered Juvederm. Now I'm a huge fan and a loyal patient, which is why I'm here to talk to you about Juvederm. Juvederm is the next generation dermal filler. As your skin ages, it loses structure and volume, which causes those wrinkles and folds. Juvederm smooths away lines and wrinkles by putting back what nature took away. Juvederm is a smooth gel dermal filler made of hyaluronic acid, or HA, which helps to attract and maintain water, hydrating your skin and increasing its volume. Smooth and natural-looking results in an instant. How great is that? With Juvederm, you're just a few minutes away from fabulous. Now, you've heard how women felt about their wrinkles and folds. Here's what those same women are saying after Juvederm.
What I liked the best is no one could figure out what I'd done.
It's true what they say. Everyone will notice, but no one will know.
I couldn't get over how easy it was. It was like, hey, where'd those wrinkles go around my nose and mouth?
And now I look in the mirror and I can barely remember what those lines were like before.
Juvederm smoothed away those wrinkles above my lips. Now my lipstick stays in place. I didn't even need my glasses to see the difference. It's like, hello, I'm back.
People would comment on how refreshed I looked. I just thought it was funny. I'd say, thanks.
Why not?
Did your doctor do those before and after pictures?
Yeah.
Because mine did, and I could really see the difference right away.
Aren't you glad we did this?
It was so easy. I tell everyone, go to the Juvederm website now.
People are so happy with the results they get from Juvederm. Now here are some more, before and after.
I love that the results are so instant.
My husband is still trying to figure out what's different about me.
If you want to learn more, check out the Juvederm website. You can learn all about Juvederm, how it works, what people are saying about it. Hey, has anyone tried the facial assessment tool?
That part of the website where you put in all that stuff and you get a picture of what you want to look like? I love it. I brought it to my doctor to show him what I want to look like.
Yeah, I tried the assessment tool too. It was so
It's
great. It helped me understand what wrinkles and folds I have on my face and showed me what Juvederm could do to smooth them away. It really helped to have something to show my doctor.
Ask about Juvederm for smooth, natural-looking results that last. Lose those lines. Look smooth and natural. You'll see. Everyone will notice, but no one will know. Ask your doctor about Juvederm. Ask about Juvederm today, because parentheses have a place, but not on your face.
Don't hold back.
Express yourself.
Express yourself by asking your doctor about Botox Cosmetic.
Yeah.
millions of women already have. Express your interest by visiting BotoxCosmetic.com. Get some of your toughest questions answered. Find a qualified doctor in your area to help you decide about the one, the only Botox Cosmetic. It's all about freedom of expression.
Art can be awe-inspiring, fascinating, and thought-provoking. Art is all around us and in many different forms, although the real beauty of art is that it can tell a story without saying a word. And like art, those moderate to severe frown lines between the brows can also say a lot about a person.
It started to make me look like I was either concentrating too hard or I was a little bit stressed out.
I was home for Christmas and I was reading a book and my mom said, "You look like you're frowning."
I think it's because I started to look angry or something all the time because the lines were there.
Everyone has their own reason for speaking to their doctor about Botox Cosmetic. What's yours? Whatever the reason, you're here to learn about the art of Botox Cosmetic and what your doctor can do to touch up those moderate to severe frown lines between your brows. Hi, I'm Lisa Masters, and I'm here to talk to you about the one and only Botox Cosmetic, a simple, non-surgical, physician-administered treatment that can temporarily treat moderate to severe frown lines between the brows in people ages 18 to 65. Botox Cosmetic, botulinum toxin type A, is a true original. It's by prescription only, and it's the only treatment of its kind approved by the Food and Drug Administration. We've created this video to help you understand more about Botox Cosmetic, what it is, how it works, and how it can visibly improve the appearance of moderate to severe frown lines between the brows. After viewing this program and reviewing the important safety information, talk with your doctor about Botox Cosmetic to see if it's right for you. Only a licensed, trained healthcare professional can administer Botox Cosmetic. Now, let's cover the questions that are on everyone's mind. Botox, botulinum toxin type A, has been used therapeutically for over 16 years to treat a variety of medical conditions. It's approved in more than 75 countries and remains the most studied botulinum toxin and one of the most widely researched medicines in the world. The same formulation, with dosing specific to frown lines, was approved by the U.S. Food and Drug Administration in 2002 as Botox Cosmetic. After Botox Cosmetic injections, serious heart problems and serious allergic reactions have been reported rarely. If you think you're having an allergic reaction or other unusual symptoms, such as difficulty swallowing, speaking, or breathing, call your doctor immediately. Over time, movement of brow muscles causes the skin to crease. As skin becomes less elastic, repeated frowning creates lines and wrinkles between the brows. Botox Cosmetic is a purified protein produced by the Clostridium botulinum bacterium that relaxes the muscles by blocking nerve impulses. With a few tiny injections, Botox Cosmetic blocks the release of acetylcholine, the chemical that causes muscles to contract. With less movement, the facial muscles begin to relax and the lines begin to fade. You'll still be able to frown, smile, or look surprised, but without the creases and wrinkles between your brows.
I'm very satisfied with the results.
My expectations were definitely met.
It was no big deal, and the results were just right on target.
This simple, non-surgical procedure consists of a few tiny injections and can be performed right in your doctor's office. No anesthetic is required. The first thing your doctor will determine are the places that need to be treated. Prior to being injected, these areas may be numbed with a cold pack or anesthetic. These are the sites where you can expect to be injected with Botox Cosmetic. Using a very fine needle, a tiny injection will be made into each site. Localized pain, infection, inflammation, tenderness, swelling, redness, and/or bleeding, bruising may be associated with the injection. Since there's no recovery time or downtime, you can even receive Botox cosmetic treatment on your lunch break. And within days, you'll see a noticeable improvement in the appearance of the vertical lines between your brows. The most common side effects following injection include temporary eyelid droop and nausea. Now, let's hear from some patients who've experienced Botox cosmetic treatment.
It was very painless. It only took about 10 minutes. I was out of there.
It's a very small little pinch that you feel, and I felt that it was really easy and much easier than I thought.
Thing about it, there wasn't any downtime. You know, like I could still go and do my errands. I could still do whatever I had planned for my day.
Serious heart problems and serious allergic reactions have been reported rarely. If you think you're having an allergic reaction or other unusual symptoms, such as difficulty swallowing, speaking, or breathing, call your doctor immediately. The most common side effects following injection include temporary eyelid droop and nausea. Localized pain, infection, inflammation, tenderness, swelling, redness, and/or bleeding, bruising may be associated with the injection. Patients with certain neuromuscular disorders such as ALS, myasthenia gravis, or Lambert-Eaton syndrome may be at increased risk of serious side effects. Full prescribing information has been provided to your doctor. You can expect to see noticeable improvements in a matter of days, and you may continue to improve during the first week after treatment. Optimal results should be visible within 30 days.
The results actually were very subtle. It took about 2 or 3 days to kick in.
You can still see expressions. I'm still frowning. There are still little fine lines.
With proper dosing of 20 units in the brow region, the positive effects of treatment can last up to 4 months. Ordinarily, you will only need to repeat the treatment 3 or 4 times a year. And treatment with Botox Cosmetic can be repeated as long as you continue to respond.
I've been doing it now for 3 years, and I love it.
I definitely would think that doing this every 3-4 months is not at all a heavy expense.
It just makes me feel like I did something for me.
According to a recent survey, most patients were satisfied with the results of their Botox Cosmetic treatment. And for 4 years now, Botox Cosmetic has been the most popular physician-administered cosmetic procedure in the United States, surgical and non-surgical combined, according to the American Society for Aesthetic Plastic Surgery. Think about your reason for talking to your doctor about Botox Cosmetic treatment, and together you can decide whether it's right for you.
I'm very satisfied with the results, and I'm satisfied with the whole experience.
Yeah, very satisfied.
I will continue to receive Botox cosmetic treatments.
I'm glad we could share a few moments together today. We hope we've helped you get a feel for the art of Botox Cosmetic and treating those moderate to severe frown lines between your brows. Thank you for your time, and please speak with your doctor if you have any additional questions.
Why ask your doctor about Botox Cosmetic?
This is my time.
Everyone has their own reason. Curious? Go to BotoxCosmetic.com to find a doctor nearby, because only a doctor can answer all your questions. What will your reason be? Ask your doctor about the one, the only Botox Cosmetic.
Isn't it about time?